Hi, my name is Mary and I'm going to be your nurse today. I just want to verify your JW.
I am.
Perfect. Okay. Well, I'm just going to kind of go over, we're going to do a health history and kind of get to know you better. What brings you in today?
Well, I decided it was about time for a wellness check.
Okay. Sounds good. How are you feeling today? Are you having any complaints of pain or
not really.
feeling sick at all?
No, I feel pretty good for
Feeling in good
overall.
health? Okay.
Yeah.
Good. Well, with that in mind, is it okay if we get started on the health history and I can kind of get to know your background a little bit?
Yeah. That'd be
Okay,
great.
perfect. Well, first I want to start off with your medical history. Do you have any history of any diseases from asthma, diabetes, things like that?
I was diagnosed with Best disease.
Okay, can you tell me a little bit more about that?
I was diagnosed with that when I was around 7 years old, very young.
Okay.
It's an eye disease.
How did you come about it? Like, how did you find out?
It was just a routine checkup at the eye exam,
Okay.
and they saw it in when they looked in my eye.
Okay. What kind of symptoms do you have associated with that?
There's chronic pain. It's periodically. It's not all the time, but when it's there, it's on I use the pain scale 1 to 10, so it could be like a 3 and might fluctuate.
Okay.
Between like a 3 and a 7 that day. It could get worse.
Any other symptoms associated besides pain?
There's pixelation. My whole vision's covered in pixels.
Sorry to hear that.
And then my central vision's a little blurry. I have night vision or night blindness.
Okay. Night vision might have
Night
been
vision.
that thing.
I wish that was the case.
Yeah. Well, I see you wear glasses. Have you always worn those?
No, recently, like last 5-10 years, I decided I needed to get them, and they've been working out. For the most part, my vision is 23/20,
Okay.
and this just helps that extra little bit.
Okay. Are there any sort of things you do to help with the pain in your eyes? Like any medications or none?
I do take
Other
Preservision and vitamins that benefit the eye, and other than that, it's just like some good sleep, maybe some ibuprofen.
Okay.
Try not to get too much light. Protect it with sunglasses and
Okay.
stuff like that.
Okay. Any other medical history you want to talk about?
I got a little bit of high cholesterol
Okay.
on my last checkup.
Are you, is there anything you're doing currently to help with that?
I've been eating healthy, haven't taken anything for it.
Okay, so no medications
no.
for cholesterol
Just trying
prescribed
to
yet?
exercise and
Lifestyle changes?
do what I can.
Okay.
Trying to avoid taking the medicine for now.
Okay. Okay. While we're on the track of medicine, are there any medications that you take on a regular basis, from prescriptions to just, over-the-counter stuff like ibuprofen or any herbal supplements?
No, not really, besides the little bit of ibuprofen and the vitamins.
Okay.
I don't take much more.
And you had said you take, you take Preservision?
Yeah.
Okay, and that's, how many times a day do you take that?
I take that once in the morning and once at night.
Okay.
Twice a day.
Okay, and then what, you mentioned vitamins. What kind of vitamins are you taking?
I just take about vitamin C,
Okay.
vitamin D, fish oil.
Okay. So trying to, do some lifestyle changes and
Mm-hmm.
take care of that. That's good to hear. Okay. And then any other, like, just as needed medicines that you take? You said ibuprofen. Is there anything else you want to tell me about?
Pepto every now and then.
Okay.
When my
Pepto.
stomach's upset.
Or upset stomach. Okay.
That's about it though.
Sounds good. Okay. Any sort of allergies that you want me to know about? Any allergies to medications?
No.
Okay.
Not that I'm aware of.
Okay. Any allergies to animals?
No.
Okay. How about any food allergies?
No, not that I'm
Okay.
aware of it.
And then any, I guess, have any seasonal allergies?
No.
Okay.
No.
Sounds good. All right. Then I guess we'll go on to surgical history. Have you had any past surgeries in your lifetime?
Yeah, I recently had hernia surgery.
Okay. You said recent. How recent was that?
September of 2020.
Okay. Okay. So very recent. How are you recovering from that?
I, do my best. It's been a little bit of a rough recovery. It seems like go forward and get set back every now and then, and
Okay.
I pull something here and there, and it's good, but it could be better for sure.
Okay. Okay. And what kind of symptoms of that are you still currently experiencing?
It varies. Sometimes it's a weird pain.
Okay.
Something that's behind the scar. Sometimes it feels like it's like pushing on my colon, kind of even in that area, a little discomfort. And
is there anything anything that kind of helps that or makes it worse?
a little ice pack is good.
Okay.
They're weird pains, but a little bit of ice pack and trying not to overextend myself.
Okay. I'm sorry you're kind of still dealing with that. Hopefully we can kind of figure out what's going on and have a better plan, okay? Okay. Any other surgical history that you want to let me know about?
I had my tonsils removed
Okay.
when I was younger. I think I was 6-ish maybe.
Okay. All right.
I went for that.
Awesome. Any family medical history that you can recall off the top of your head?
I know my dad has high cholesterol.
Okay, so that runs in the family. Okay.
He takes medication for it.
Oh, he does. Okay.
Yeah.
All right.
Yep. And I believe his mother she has high cholesterol as well and takes stuff for it.
Okay.
She also just had a stroke.
Oh, I'm sorry to hear that.
No, thanks.
Okay.
She's doing good though.
Okay, she's doing good.
Yeah, recovered well.
Okay.
There's been, cancer throughout the family as well. My brother had non-Hodgkin's lymphoma.
Oh man, I'm sorry to
Yeah.
hear that. He's doing okay? Is he in remission?
Yeah, he's about 21, 23 years in remission
Wow.
now. He got diagnosed young. I think he was like 3 range.
Wow.
Yeah.
That's kind of
Yeah,
uplifting
really young.
for sure.
And Children's Hospital
Okay.
saved him.
Wonderful. Okay. Yeah. Well, it sounds
There's
like
also been lung cancer in the family.
in the family.
as well.
Okay. Okay. I'll make note of that. Thanks for sharing.
Mhm.
So it's good that you're taking all those vitamins and kind of trying to have some lifestyle changes.
Mhm.
Are your vaccines up to date?
I did get the last flu vaccine, but besides that, yeah, I
Okay.
believe so. Yes.
Okay, so just your flu shot, your yearly flu shot is just a little behind. But you have like your tetanus and your hepatitis and
Yes.
yeah.
I have
Okay.
all that.
Okay, perfect. And then I just kind of want to know a little bit about your social history. Any use of tobacco, smoke?
No.
Okay, any exposure, just secondhand smoke?
Definitely secondhand.
Okay,
Yeah.
is it you live with it or?
Periodically, maybe at work, and
Okay,
my dad smokes.
okay, okay.
Here and there.
Any history of alcohol use or recreational drug usage?
No drugs, but I drank when I was younger.
Okay.
But I haven't drank in 10 years.
Okay. All right.
So I don't. Yeah.
Okay. And then what do you do for work?
I'm an HVAC technician.
Okay. Okay. So definitely
I'm lifting all
using
a
your whole
lot,
body
and-
for that, for sure.
Yeah.
Okay. Okay.
Doing all sorts of stuff like that, and it can strain the back from time to time.
Yeah.
You know.
Definitely. Okay. And now that we kind of got your background and stuff, I just want to kind of go through, head to toe systems in your body to make sure that we're covering all our bases. Okay.
Mm-hmm.
The first one I'll talk about is cardiac. Have you been having any issues with your heart, kind of heart palpitations, regular heartbeat, leg swelling?
Okay. No, I wouldn't say no.
No.
Not really. No.
Okay.
It's
Okay.
been pretty good.
Okay. Any respiratory issues, chest tightness, coughing, shortness of breath?
No, I went for a run the other day and felt pretty good.
Okay.
Breathing.
Good. Okay. You said you had gone for a run. Is exercise kind of something you?
I've been
do
trying.
periodically?
I've been trying. You know, I've got my dog, so I take him for a run and walk and hike and stuff
Yeah,
like that.
hiking's good, and it's getting warmer out, so you can definitely get outside and do some more stuff.
Yeah.
How are your your head, your ears, nose, throat, that kind of all the systems up there?
My ears have been clogged for a long time.
Okay. Can you tell me more about that?
Yeah, from what I know, I believe it's from the ears to the throat, and it's clogged with something. I'm not sure what. An old primary doctor sent me through a specialist for it, and there wasn't much of a follow-up. You know, they did a bunch of stuff, but ultimately they wasn't sure why it was clogged.
Okay.
And they want to do a more intense, surgery or something on it to figure it out and just have it proceeded.
Have you had any? I know we talked about your surgical history, but there's no ear tubes or anything that you had when you were younger.
No.
Okay.
No, not me. My brother does have tubes.
Okay. Did you have lots of ear infections when you were young, or?
I might have. I know that there was a reason why he had the tonsils removed.
Okay.
Something was going on.
Okay.
I think that's sometimes a correlation between, right?
Okay. Yeah, possibly. I know sometimes obstructive sleep apnea is a big reason why people get their tonsils removed, but yeah. Okay. So hopefully we can kind of figure out. I'll take a look in your ears and we can kind of figure out what's going on with why they're clogged. Okay. Any issues with your eyes? I know you said you have this Best disease, so that causes a lot of pain and visual disturbances. But any redness, itching, things like that?
They get red. They get dry.
Okay.
You know, I think it's just from the Best disease.
Okay.
You know.
What do you do for the dry eyes?
I take a little bit of Visine from time to time.
Okay. And that's
try
not
to do
kind
too
of
much of it. Yeah.
Okay. Okay.
I feel like it's can't be too good, even though they say it is.
Yeah. Okay. Any issues with your stomach issues, gastrointestinal, nausea, vomiting, diarrhea, abdominal pain?
Yeah, a little bit by the hernia area.
Okay. Can you tell me more about that?
Pressure feels like, pressing on the colon.
Kind of since the whole hernia surgery and the issue of it?
It's been a little off.
Okay.
A little off for sure.
And what makes that kind of pain worse?
Worse would be just stressing it out throughout the day.
Oh, so all day at work?
Yeah.
With HVAC, yeah.
Lifting and moving and bending.
Okay.
And then a little bit of ice pack. Okay. That's all I can really do for that area.
And does that seem to help it?
It does help it.
Okay.
I would say it definitely helps it.
Okay.
Okay. That's about it though.
Okay, I'll make note of that. Thank you for sharing that. How about any trouble urinating, any blood in the urine, discomfort, pain, frequency, things like that?
I do think that I pee too frequently.
Okay.
I just can't hold my bladder long enough.
Okay.
I've been trying to hold it longer, which I don't know.
Yeah. Okay. Well, we'll definitely check into that and see what's going on. Do you feel like you're drinking more frequently too?
Yeah, I would actually say I'm drinking. I drink a lot of liquids.
Okay.
So I would say I am, but I should be able to hold it longer.
Okay.
So.
All right. Well, we'll make note of that. Okay. Any issues musculoskeletal wise? Any trouble lifting things at work or having some back pain?
For the most part, I'm pretty strong. A little bit in the back. My back's a little sore. I got back pain here and there.
Okay.
I'll have to lay down.
Laying down helps it?
Yeah.
Okay.
Laying down, just getting the weight and stress off of it.
Okay. All right. Any issues with your skin? Any rashes, change of colors, things like that?
No, my skin's been good. I've never, even acne, I haven't really ever had it.
Okay. Good. All right. What about any neurological issues? Any dizziness, numbness, headaches, lightheadedness?
No, not nothing that really rings a bell.
Okay, all right. Any issues with bleeding when you kind of get a cut? Do you have like excessive bleeding, bruise easily?
No, I actually think I heal for the most part pretty quickly.
Okay.
Anytime I cut myself at work, it tends to heal
Okay.
pretty
Good.
fast.
Okay. Awesome. So we've covered all of like the physiological things. I just want to kind of go over more of the psychological, just to make sure we're covering all our bases and making sure you're okay. Have you had any thoughts of suicide, any depression, increased agitation, any hallucinations, things like that?
No, nothing like that.
No. Okay. Sounds good. Well, those are all my questions. Do you have any other questions or concerns you'd like to ask me right now?
No, I think you've been great.
Okay. Well, thank you so much, JW, and hopefully we can get some of your concerns addressed, okay?
Great, I look forward to it.
Okay, perfect.
Thank you, Merce.